Hello and welcome to today's video, Understanding Anxiety and Stress in Children. Anxiety and stress are common experiences for children and can be triggered by various factors such as school pressures and academic expectations, social relationships and peer interactions, family dynamics and parental stress, or traumatic events and significant changes. Recognizing signs of anxiety and stress in children can differ. Children may exhibit different signs of anxiety and stress depending on their age and individual characteristics. Here are some common signs to look out for. Physical symptoms, including headaches, stomach aches, fatigue, and sleep disturbances. Emotional symptoms include irritability, mood swings, tearfulness, or withdrawal. Behavioral symptoms such as avoidance behaviors, restlessness, fidgeting, and perfectionism. Cognitive symptoms include worries, fears, negative self-talk, and difficulty concentrating. Now, here are some strategies for parents to help their child manage anxiety and stress. First, encourage open communication. Create a safe and non-judgmental space for your child to express their feelings and concerns. Listen actively and empathetically to your child's worries and fears. Validate your child's emotions and offer reassurance without dismissing their concerns. 2, teach relaxation techniques. Deep breathing exercises are great. Encourage your child to take slow, deep breaths in through their nose and out through their mouth. Progressive muscle relaxation. Help your child tense and then relax different muscle groups in their body. Visualization. Encourage your child to imagine a calm, safe place or activity. Next, encourage physical activity. Regular exercise is great. Encourage your child to engage in physical activities they enjoy, such as sports, dance, or simply playing outside. Yoga or Tai Chi. These practices can help reduce stress and anxiety while improving flexibility and balance. And next, help your child develop problem-solving skills. Encourage your child to identify problems and brainstorm solutions. Help your child evaluate the pros and cons of different solutions. And encourage your child to take action and try out their chosen solution. Next, model healthy coping mechanisms. Demonstrate healthy coping mechanisms yourself, such as taking deep breaths or encouraging and engaging in physical activity. And share your own experiences and feelings with your child and explain how you manage stress and anxiety. Next, provide a stable and predictable environment. Establish a consistent daily routine that includes time for relaxation and fun. And create a cozy and comforting physical environment, such as a calm bedroom or a favorite reading nook. Now, avoidance behavior is a common coping mechanism for children with anxiety, ADHD, and other challenges. Yes, avoidance can make anxiety worse in several ways. First, it reinforces fear. Avoidance reinforces the fear or anxiety associated with a particular situation or task. By avoiding it, your child may feel temporary relief, but the underlying fear or anxiety remains and can even intensify. Avoidance also increases uncertainty. Avoidance can create uncertainty and unpredictability, which can exacerbate anxiety. When your child avoids a situation, they may worry about what might happen if they were there to confront it. Avoidance limits exposure. Avoidance limits your child's exposure to the feared situation or task, which can prevent them from learning to cope with it. The more your child avoids something, the more daunting it may become. Avoidance also strengthens anxiety habits, such as rumination, worry, or escape behaviors. These habits can become ingrained and difficult to change. Avoidance can also reduce your child's confidence in their ability to handle challenging situations. This can lead to increased anxiety and decreased motivation. Avoidance can also increase anxiety in other areas. Avoidance in one area can lead to increased anxiety in other areas, such as your child avoids a particular task at school, they may start to worry about other tasks or situations. To break this cycle, it's essential to encourage your child to confront their fears and anxieties in a gradual and controlled manner. This can help them develop coping skills, build confidence, and reduce anxiety over time. Now, here are some strategies to help your child overcome avoidance and build confidence. First, gradual exposure. Encourage your child to confront their fears in a gradual and controlled manner. Next, CBT, cognitive behavioral therapy, can help your child identify and challenge negative thought patterns and behaviors. Use positive reinforcement. Reward your child for facing their fears and taking small steps towards overcoming avoidance. Building self-confidence. Encourage your child to engage in activities that promote self-confidence and self-esteem. Parental support. Offer emotional support and encouragement as your child works to overcome avoidance and build confidence. Now, here are some strategies parents can use to address avoidance behavior. First, understand the underlying reasons. Identify the triggers. What is causing your child to avoid a particular task or situation? Is it fear, anxiety, or frustration? Next, recognize the function. What purpose does the avoidance behavior serve for your child? Is it to escape discomfort, avoid failure, or gain attention? Next, encourage gradual exposure. Break tasks into smaller steps. Divide daunting tasks into manageable, less overwhelming steps. Create a hierarchy. Develop a list of tasks or situations that your child avoids, ranked from the least to the most anxiety-provoking. Gradually increase exposure. Encourage your child to confront each task or situation on the hierarchy, starting with the least anxiety-provoking one. And use positive reinforcement. Reward small successes. Praise and reward your child for each small success, even if it's just a tiny step forward. Also, focus on effort, not outcome. Emphasize your child's effort and persistence rather than the outcome. Celebrate progress. Acknowledge and celebrate your child's progress, no matter how small. Provide support and accommodations. Offer emotional support. Be available to listen, offer reassurance, and provide emotional support. Provide accommodations. Offer accommodations such as extra time, a quiet workspace, or the use of a graphic organizer. Teach coping skills. Help your child develop coping skills such as deep breathing, visualization, or positive self-talk. Set clear expectations and boundaries. Clearly communicate your expectations and the consequences of not meeting them. Set firm but loving boundaries to help your child understand what is expected of them. Encourage your child to take responsibility for their actions and decisions. Now remember, addressing avoidance behavior takes time, patience, and consistency. By understanding the underlying reasons, encouraging gradual exposure, and providing support and accommodations, you can help your child overcome avoidance behavior and develop more adaptive coping mechanisms. Now, seek professional help when needed. Consult with a therapist if your child's anxiety and avoidance behavior is severe or interferes with daily life. Consider consulting with a therapist. Collaborate with teachers. If your child's avoidance behavior is impacting their academic performance, collaborate with their teachers to develop a plan. Now remember, every child is unique, and what works for one child may not work for another. Be patient, flexible, and responsive to your child's needs, and work collaboratively with them to develop strategies that help them manage anxiety and stress. I hope you found this video helpful, and as always, don't forget to like and subscribe for future content on mental health. See you next time.